Hi guys, my name's Nyree and I'm running an adoption support channel, and I've got two adopted boys. We've had issues around wetting and soiling, so I'm just going to share some of my experiences and just help you to unravel a little bit why children do it and some of the ways that you can get around it really. I think the important thing to remember is that when children move to us for adoption, that in itself is a trauma, and so sometimes it can take a while for things to settle down. So we've gone through the journey of being told that we need to go through therapy first. Before we start seeking out specialists, before we start seeking out medication, we need to do the therapy, because if it's anxiety based, then no matter what we do from a paediatric point of view, we're probably not going to be able to help him. So that's what we've done, gone through lots of therapy with him. And sometimes we look at the situation, because he works a lot at night, and we think, actually, sometimes we think it is emotionally triggered, and other times I think it's not. We've been unpicking this for many, many years. And I always think that it's really important as well that if they're open to discussing their abuse with you, then it's really important that you do and you don't shy away from it. Because if children have been sexually abused in particular, then toileting, wetting and soiling is a really common problem. Wetting by day and not getting to the toilet on time is one thing. Wetting by night is a little bit different, because clearly the child doesn't always know it's happening. And this can be down to the fact that they've been sexually abused. It's kind of like a mixture of what's happening to them physically and what's happening to them mentally. It may be that in time you're going to need medication to help them to stop, their bladder to stop downloading at night. And it's important to just go through the kind of emotional side of it first. And then if that doesn't work, then you may have to seek out help for them at night to, help and support them to get past that stage. We used pull-ups for children for long periods of time when they were wetting at night. Much easier on the washing machine, but it's probably not the best way to go. So in time, you kind of need to move away from the pull-ups. And sometimes they can cause extra urinary tract infections as well, as the pull-up rubs on them. So if you can move away from pull-ups, then I definitely would. But again, it depends if you can cope with the amount of washing that you might have, which none of us want to keep on washing bedding all the time. Moving on to soiling, that's probably a little bit more unpleasant. And what we found is, because of the abuse, then my son would hold back on going to the toilet, which in turn had a knock-on effect to him becoming constipated and not wanting to use the toilet. And then you end up with kind of like smearing in the pants and things, because they're not really going to the toilet properly. And it might be sometimes you need to accompany them going to the toilet to help them to overcome that fear of going, because some children just don't like pushing. They don't like pushing the poo out. It just makes them feel really uncomfortable. What we found is that with neglected children, they don't care if they sit in it. They don't care if they walk around in dried pants with urine on. They don't really care if there's poo in their pants. So you're trying to encourage them to improve their self-worth, but they don't really care if they go around like that. And that's obviously down to like a history of neglect, which we've seen with our boys. So it's lots of things that you're counteracting, because you don't 100% know if it's not a developmental thing or a medical thing. And you kind of need to rule out everything, whether it be from the therapeutic side or it be from the physical side, and then seek out the professionals that can give you what you need if you're going to need medication. Very, very common, and I think you just got to go through it with your child and to stay patient and remind yourself that it's not deliberate. They're not doing it deliberately. It feels like it sometimes, but just remind yourself that it's not deliberate and much of it cannot be helped. If you found the video useful, then please take the time to subscribe and check out my channel, and I'll see you on my next video.